My name is Dr. Brian Williams. I'm a orthopedic hand surgeon. Here at Orthopedic Specialists, we see a wide variety of people coming through with multiple different diagnoses and problems. Dupuytren's disease, or Dupuytren's contracture, is a tightening up of the fascia in the hand that will extend up into the finger and ultimately causes a bending of the finger, or flexion type deformity. Sometimes it's not very bad, other times it is so bad they can't get their fingers straight at all. I hear lots of different complaints from I can't pick up things, I can't button my clothes. Really depends on which finger is involved and how bad the involvement is on that particular finger. Originally, the treatment was basically just wait till it gets bad enough before you operate. Now, with the advent of Xiaflex and the introduction of that particular product, I think it's been a tremendous boon to anyone who treats Dupuytren's disease, because now with a simple injection and manipulation, we can do what we would have to do otherwise in an hour-long surgery with lots of possible risks associated with that surgery. Once we perform the manipulation and we actually break that band of tissue that's causing the contraction, I have found it particularly beneficial to use the Dynasplint finger splint to try and maintain the extension of the digit. The natural tendency of the digit is to return into the flexed posture that it started with before we did the injection. And with Xiaflex, we're not removing this tissue, all we're doing is breaking it. So if the tissue was allowed to come back in contact with itself for a long enough period of time, it will naturally try to heal back together from where it came from, thus basically defeating the entire purpose of the procedure that we just performed. So I use the Dynasplint product all the time so that the patient will have a much better chance of maintaining that extended posture, thus hopefully eliminating the need for a second procedure. I would wholeheartedly recommend the use of one of these dynamic splinting apparatuses following the manipulation of a Dupuytren's. I have used the Dynasplint product exclusively. I find that it is very easy to use, and with the assistance of the representative from the company, it makes my job a lot easier. The patients really love the fact that somebody's there to help them throughout the entire process, and it overall, I believe, increases the success rate dramatically.